workers are being tested when they're showing symptoms. Susan is speaking to us as a GMB rep whose union wants her whole team tested urgently.
So today we're gonna be this game into the last, but today we're going back. It's Halloween update.
You have to get with your hearing.
To use the toilet, so and change on. So I was right next to it and cleaning up the bodily fluids. Yeah, I felt better that I was wearing the face mask.
Cross-contamination, huge concern. So have you got non-COVID patients today as well?
Yes, definitely. Sterile and you can scrub yourself.
It's a £13 an hour job, but all Susan wants is a little more understanding.
We're not looking for free bus fares and free coffees and what have you. Just
Oh my god, you have to cough at the worst of times, don't you?
I'll put it here. Yeah. Tomorrow. Next day she'll travel to get now she's going to hunt for hand gel. You take care. We at least managed to spare her that.
No, some money.
Died at the Tranent care home in East Lothian after it became the latest residential care home to suffer an outbreak of COVID-19. Across the UK, at least 9 care homes have reported COVID-related deaths. To talk some more about this, I'm joined by Kerry Roberts, who manages 2 independently run care homes in North Wales. And what's your situation?
Well, fortunately at the moment we don't have coronavirus in either of the homes. I'm delighted to report. However, we do have a huge issue with the lack of PPE. I tried to purchase some yesterday and I was told that the PPE had been purchased by Public Health England and that anybody that worked outside of England would not be able to access any of the PPE that this company had. In hand.
Game. Yeah.
Every other once a year or throughout
No,
the year we do buy from this company and all of a sudden people in Wales are unable to buy this product.
And have you spoken to
Sorry,
the
I'm
authorities
playing
at
on
all
my
about
Android,
getting
so
hold of potential
two nursing homes looking after 78 vulnerable individuals and a team of 120. And it's just so important that we look after the team, that we give them the PPE so that they can do the difficult job that they have to do. I've also cared for on both.
I was going to ask, what about the residents and their families? Visit them anymore?
It's extremely difficult. We closed our doors on the 4th of March. The families are not.
Do you need anything beyond the PPE?
I mean, at the moment, we normally have a large supply of PPE, but because our normal supply has not been able to supply any, apparently the manufacturer that they use have given a bulk of the PPE, especially the aprons, to NHS England. So at the moment, it is the PPE that we are desperate for.
Okay, Kerry Roberts, thank you very much indeed. Now, Africa has so far been the continent least affected by the COVID pandemic. But it's not the first time it has suffered.
So what are
from
you
the
doing
virus.
at 8 o'clock in a few moments?
West Africa
Bugling.
is in the middle of the
Yeah.
Ebola outbreak in Africa. Many UK volunteers helping fight, saving lives. They're now Jamal Osman has this report.
Portions are too great. It's
Already, is it?
Yeah, it's under the stairs.
these
8 minutes to
particular
go.
measures, though familiar, predate
Okay.
coronavirus. These are for Ebola.
Dealing with
Ebola,
this was
that is the coronavirus
to get my
in
hands out, actually
that country.
as a result of that.
Yeah, I don't know geography.
UK health volunteers working on the front line of the 24
Oi, oi, I'm back on the contestant down today. I'm looking nonsense.
from King Solid, 4 days on the ground in Sierra Leone when the outbreak hit. Gaining skills the NHS is desperate for in these current times.
A skill that I've been able to transfer that I've learned during the Ebola outbreak is, and I didn't realise I had until now, was just being able to problem solve inequalities.
Natalie's back home working as an infection prevention nurse, finding very practical uses for her hard-earned experience.
Because I've got a knowledge of like decontamination from Ebola, so I was working out how we're going to go into someone's home and test them and then decontaminate inside their home in a safe way, and setting up that process and getting all the PPE supplies sorted and kind of training people and setting up a training program.
The most deadly outbreak of Ebola was that of 2014 in West Africa, concentrated mainly around Liberia, Guinea and Sierra Leone. Ebola is a particularly lethal disease, killing around half of those it infects. During the outbreak, nearly
Yeah, Ebola sounds
30,000
almost
people were
worse.
infected, killing more than 11,000
When your eyes
before
stop
ending
bleeding
in
and everything, don't they?
2016.
That means you're gonna die.
Many of those on the front line of fighting Ebola are now involved in the UK's current response to COVID, some at the very highest level. Chris Whitty, the Chief Medical Officer and the face of the UK's coronavirus response, is one of them. He was at the forefront outbreak, and the lessons learned are being applied back here.
The most important lesson was the importance of communities. Communities absolutely need to understand how they need to behave. They need to really engage with the health professionals. They need to own the crisis. The second thing is leadership and government must be strong.
You better wash your hands, boys.
Communication, is critical.
Community response, strict measures, mobilization and understanding did finally conquer the West African epidemic. Although it's still there, coronavirus has now gripped Africa. But for countries who bore the brunt of Ebola, they are now better prepared for this new threat.
I mean, certainly the Sierra Leone response, if you use that as an example, has learned extensively from Ebola, all the different key aspects of public health management. So, of cases for having adequate treatment facilities where they can isolate and safely care for people. So, from the systems approach, they're in a much better state than they were going back sort of 5-6 years ago.
For the advocates of a stronger global health cooperation, it's not just those countries that receive help that benefit. They argue that the UK's involvement abroad strengthens its own defences.
I don't think the UK is going to be able to rise the current health problem or other future health challenges without the weak health systems in lower middle income countries. We can learn a huge amount through engaging in lower middle income countries.
Hi, Waffy.
We probably can take some of that learning back into the UK.
Viruses like Ebola and COVID breed fear,
It's not very nice, is it?
finding individuals
Just stop telling Daddy you hate him. I know that you do.